This is the Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
Well, if you read the Anchorage Daily news, you will often find articles from our next guest. Zaz Hollander joins us. Hey, headline right now, impossible choices inside Alaska's inundated hospitals. Zaz, your coverage has been profoundly helpful to me as a semi-journalist as I report the news every morning, but I've talked with friends and family, and if they know your name or not, Anchorage Daily News coverage on healthcare, which has been the lion's share from you, has been important for us to know where we're at. And so thank you for that. Good morning. How are you on this snowy Tuesday?
Good morning, Tom. Well, thanks very much for having me on the show to talk about such an important issue. And yeah, we are, there are a few of us who cover healthcare, so I'm certainly not alone, but it's definitely keeping us busy with the current COVID-19 surge that's going on, unfortunately.
Of course. And if your ears ring, I quote you often and, give you attribution to ADN and the team when I do my news. And it's another Zaz Hollander report. I have to first get into your awesome credentials. How long have you been with, and I've known you a long time, but how long have you been with Anchorage Daily News? And is your focus primarily Matt Sue, and then they've tossed on healthcare? How does that work? But first, your background there, because you're one of the, you're still a young lady, but you're one of the senior reporters there by far.
I am probably the oldest reporter, especially with Beth Bragg, who's retiring
I
after
love
an
Beth.
illustrious career as a sports
Sure.
writer and editor. I'm a veteran, I guess I'll put it that way. I started at ADN in 2001 and had worked at a couple different papers, a paper in Oregon, Daily Astorian, and then the Spokesman Review out of Spokane.
Of course.
Before coming up to Alaska. So it's been 20 years that I've been at the ADN. And yeah, Tom, you're right. Normally I focus on Matsu plus some aviation and general assignment reporting. And when COVID hit last year, when the pandemic started, I was kind of moved over to cover COVID. And, it, for better or for worse, it really kind of turns into a full-time job. There was a point over the summer where this wave had subsided and things were kind of getting back to whatever normal is going to be, and I could cover Matthew stories again, and it was great. But unfortunately, we're kind of back to all COVID all the time right now.
Well, you're someone that I particularly am a fan of, not just because we know each other, just through connection, but I'm a fan because you come at stories intellectually, academically, not with partisanship. And I know you might come back and say, well, David Hewlin and team and the Binkleys, we strive for that. That's kind of the undercurrent. Don't be partisan. But everybody has an opinion. And in your case, you don't show kind of party loyalty or partisanship. And I just think it's a big deal. And you're a standout for that. But when it comes to healthcare, and you and I talked off air, that's why you agreed to come on. I said this is not about partisanship. That probably was a magic line to you. This is about healthcare and saving Alaskans and the right policy to ensure more Alaskans are saved. And I texted you over the weekend that a friend of our families, the patriarch of it, the father, I'll just say his name, Roger Graff, passed away, and very sad. It's been on all over Facebook, and Connie's been fighting cancer all over Facebook, so it's not hidden. And the Graff family and their daughters are just really good friends, lots of grandkids, and he passed away, and I'm still thinking about it today. And Annie had wrote that he had COVID as well, and that was part of the reason. And when we look at the fatality rate and we look at the numbers, what bugs me is when partisanship does come in play, especially the attitude of, hey, you're not dictating anything to me. I'm a citizen. I don't want to hear it. How do you suppress your frustration or not? My guess is you get a little frustrated when you go to emergency room and see people dying and you get worried about it as a reporter thinking, whoa, this is prolific. How do you suppress your feelings on that and write an article without getting angry? Because I would be angry.
I guess
hey, there's eggheads on
there's
one
two
side.
answers there.
This is Tom Hollander
Yeah.
reporting. It doesn't work. I'd be fired the first day.
I think that there is, for one thing, it's really just deeply sad what's happening now. I've talked with, I don't even know how many doctors and nurses and healthcare providers about patients they're seeing, and some of whom they're really, really sick, and they finally realize that, okay, this is much worse than whatever I expected a COVID-19 vaccination would be, and they want to get vaccinated, and they can't at that point. It's too late. They have to kind of weather the disease, and then they can get vaccinated afterwards, because studies are showing that even if you get COVID, getting vaccinated, at least a dose after that, is probably the best immunity you can get. And so some people are up for it, but boy, I've been talking with a number of healthcare providers who say even people are literally dying, about to be intubated on heavy oxygen, and are still denying that the virus is even real. And so, to answer your question, Tom, I am just trying to be as factual as possible so that most people will read my story and not dismiss it. Right, not dismiss it as, having some kind of bias one way or the other. It's hard. I can understand why people don't want to be told what to do, right? And so I get that. But boy, the consequences in this case of not voluntarily getting vaccinated are what we're seeing now. In hospitals, and then Alaska just became the highest state in the country for our new COVID-19 case rates. We're up ahead of West Virginia and Kentucky now.
There's your breaking news from Zaz Hollander, Anchorage Daily News, 20-year reporter. You quoted in your article this morning Jared Cozen over at the Alaska State Hospital and Nursing Home Association, and he said, hey, you're not going to see a collapse. Care gets rationed to more extreme levels over time. I know that folks in the advocacy world, in the trade association world, and then, of course, the providers themselves, the chiefs of staff, the practitioners, hospital administrators, they're probably trying to give a fair and balanced reaction to what's going on. It's severe, it's exigent. People, get your vaccination, get tested, but also we haven't collapsed yet, and have faith in the system. So with that narrative, I want to get into really quick, and then we're going to go to a break and come back with Zaz Hollander from Anchorage Daily News. Have you had some all-stars? I won't go into the ones that say no, declining an interview. Have you had some that stepped up and said, no problem, we're fully accessible to answer your questions, that you were impressed with? I'm assuming the hospitals.
Yeah, and that has become more and more reality, which is good. We've seen reports from other states where news crews, TV news crews, newspapers actually get into the ICU, and we'd love to do that. But barring that, having doctors coming forward because they feel so strongly that this message is that urgent.
They care. No, you've had access for sure. More. And I'm cutting into you because we got a break, Zaz.
Talk about it.
We're with Zaz Hollander, Anchorage Daily News. You hear the music. There's a break. We're going to come right back. One more segment with her from Anchorage Daily News. We're going to talk about healthcare and journalism in Alaska. Stay with us. Tom Anderson Show.
This is the Tom Anderson Show, broadcasting live from the KVNT studios, 7 to 9 a.m., Monday through Friday.
And that's correct. From Anchorage to Matsu, Eagle River, and beyond, online at TomAndersonShow.com. October 1st is our 10th year on this show uninterrupted, so it's such an honor to have all of the commuters listening this morning. Zaz Hollander is with us, returning after the last segment. She is an Anchorage Daily News crackerjack reporter, 20 years there, and worked in the Pacific Northwest before that. She must have been a kiddo when she started. Zaz, we're talking about something that's, yucky times with the pandemic and healthcare. You've done the Matsu coverage forever, and now they've added on to your plate healthcare. And just this morning, we were talking about a news story, and I will put the link on our podcast, and we'll link it on our YouTube. We're going to make a YouTube video of this as well. Impossible choices inside Alaska's inundated hospitals. We're making national headlines. You talked and alluded to last segment that now we're record-breaking. And what is that again? That means not in numbers, because Alaska has such a small population, but the classic term per capita, we're the highest. Yep. What right now? What is it that we're highest?
The highest new case rate in the nation. So we're at 114 per 100,000, which is nowhere. West Virginia's at 101, and that's the closest. The national average is 41.
Okay.
So
and total
it's
beds in Alaska occupied, you have a lot of good stats, and I love your ADN team. Remember, I have an ad agency day job, and we have designers, and the best designers out there. ADN really has good people, and your graphs are just they're current, and they're thoughtful, and they're very easy to read. I asked you before we ended the last segment about your go-tos, and then I led it by saying probably hospital administrators. But let's get into that, and then your sources. Who are other entities, like is it the commissioner? Is it Ann Zink? I love Ann Zink. She was on last week. Is it statespeople and politicians? Who are your go-tos that, and you don't have to go on the negative side, but on the positive, that respond and talk to you as a journalist? And secondly, where do you get this data? Is it government related or from where?
Those are all great questions. And before I launch off, a shout out to our one graphics guy is Kevin Powell. He is it. So he does great
awesome.
work. Been at the paper
Kudos.
for a long time. Yep. And so in terms of sourcing, I have a ton of physicians and a fair number of nurses in my phone. And some of them can't speak on the record, but a lot of them increasingly can. And so those are the people that I circle back to because what we're really trying to do is just talk with people with firsthand primary information about what they're seeing. And so those interviews, especially lately, have been invaluable, I think, to paint a picture of what's really happening with healthcare in Alaska. I mean, Providence is now at crisis standards of care, which is, a worst case scenario that we really didn't think we'd get to after that initial wave in April 2020 kind of subsided. And here we are. And a number of other hospitals have gotten close, as I understand it. So that's the other, Jared Kosin at the Alaska State Hospital and Nursing Home Association. It can be helpful just to parse the data that, in general, Tom, you're right, it comes from the state. It comes from the state health department. They have a COVID dashboard that they update every day during the week. And that has case numbers. It has vaccination rates. It has hospital data. I just checked the hospital data today. In the statewide hospitalizations are down a tiny bit from their record highs of a little bit earlier in the month. But Matsu Regional is 41 COVID patients, which is over 43% of all the patients at our hospital, right, Tom and I live here.
I'm out in the valley in Meadow Lakes, you bet.
Yep. And that is a lot for that hospital. I mean, they have a 14-bed ICU, and a lot of the COVID patients, once they get seriously ill, they need ventilation of some kind, so they end up in the ICU.
And they're stretched thin. I lost my brother 2 years ago there, Zaz. I have one brother, and he died, had stomach issues, and I was there in the ICU. He'd passed away right there at Matsu Regional, and so it's serious, and not from COVID, but then COVID struck. He probably would have passed from that. It is bad. The numbers are bad. When we look access to the governor's staff, I presume you have some level. What about Mayor Dave Bronson and his team? Has there been access and open, hey, we're willing to talk, let's communicate, we can Zoom? I know that they've just integrated in, but he had promised to be open and accessible and transparent to the media. Have you found that? Or is it too new?
Boy, it is pretty new. And, with any administration, there is the administration itself, and then there is their various departments and staffers. And so, Anchorage Health Department is still intact. A number of high-level people left, with the changeover, with the transition, which also happens with new administrations. I think that remains to be seen in terms of the mayor's transparency. He held a press conference fairly early on where he and his health officials answered all kinds of questions. More recently, he's been involved with, we're looking into this, and the Landmine has reported that there was a invite-only session on Saturday that the mayor was involved in. It was called by another assembly member, Jamie Allard. And
that was the one over the weekend where a bunch of people came.
Yeah, invite only.
Yep. Yeah,
So
I saw
that one.
Oh boy! Well, as you report on those, we will find out more on what the rationale is for those. Some of them remember allergies to call into the show, and we had Ethan Berkowitz on. We've had a lot of people that call in from all sides of the spectrum and vantage point. And yeah, the more of those interviews you can get with a Jamie Allard, with a Bronson, with the people that attended that, what their mindset is. I mean, they were pretty close quarters, probably maskless. What's their opinion on that? I love the fact that you cover that side of it. I don't agree with it, but I like the coverage of it. And
well, I mean, I think that's one of the problems right now, Tom. Not to cut you off, but I'm going to forget what I'm going to say. Is that those sessions where you have however many dozens of people expressing their frustrations as employees over vaccine requirements. That's happening. I mean, we've interviewed people, who are reluctant to get vaccinated, don't want to be told to get vaccinated, are working in healthcare and other fields. And that's certainly happening out there, but that turns into a political football when it gets expanded into a kind of a broad sweeping statement like, the mayor has been making and other officials, that the hospital crisis is because of losses due to vaccine requirements. And we're not seeing that. I think that's a piece of it. It may be a small piece of it, but there are a lot of other factors, including people sick with COVID or in quarantine because they're exposed to COVID, that are factors in staffing as well, and burnout and high pay for traveler nurses in other states. There are all kinds of factors that are driving these staffing problems that are now driving this hospital crisis.
But the numbers of COVID across the nation, without question, I wouldn't even have to interview to know this, is because people aren't vaccinated. It's certainly not people are dying and succumbing to COVID because they were vaccinated. So I hope you're not interviewing someone who responds like that, because that's nonsense. We have a COVID problem because people get COVID for whatever reason, and many of them were not vaccinated in the first place, and then they get it, and then they succumb to it if they have underlying maladies or age or those things. I mean, you've reported on that, and others have. So I hope people understand that as we talk with Zaz Hollander. I'm recommending Tom Anderson get your vaccination. Get the Pfizer, get the 2. If you're 65 or have underlying health care, or your health care provider in November, get the booster. I mean, the FDA just approved it. That, to me, that's common sense. As you move forward, Zaz, we're getting close. We've got a couple minutes left. What will be the next kind of, I guess you could say, layer of your reporting beyond numbers? Do you have anything in the queue forthcoming that you'll cover, maybe a niche area of healthcare and a story?
Well, we are wondering what's going to happen with additional crisis care declarations. The state has formed a committee to talk about that. We don't have a state-level crisis care declaration the way that, say, Idaho does, and that gives hospitals around the state the option to start prioritizing care. It also gives legal protection to the hospitals and providers within them, which is also important. So that's one piece of it for sure. I do want to know more about healthcare workers. I'd love to get to how many really are leaving their jobs because of vaccine requirements. That to me, because there's so much misinformation surrounding that topic, I would love to get the truth on that. So
I know a traveling nurse.
Trying to get to.
I know a traveling nurse. I won't say what hospital. High-end, top tier, and she's being recruited to come back to a hospital, and I can get you to talk to her, but I'm not going to say her name. You can talk to her anonymously. And then what about families? If someone wants to reach out to you, that you can find Zaz at adn.com and look her up. What about someone there? Would you like to hear from people who've lost a COVID victim? Are you interested in those stories?
We're interested in talking with anybody who wants to talk with us about COVID.
Okay. And then basically the story can continue, and we can get a perspective from the Alaskan vantage point and from a victim or a family member. Zaz Hollander, it's always a pleasure to talk to you off air. I'm glad you had time to come on this morning. We'll make a YouTube video of this. I will post her most recent articles in the notes of the YouTube video and of this podcast, and we look forward in the future, hopefully with a better, more happy storyline to get you back. Okay, please drive safe out there, Zaz, with the snow.
Great. Thanks so much for having me on, Tom. Stay safe.
Absolutely. You too. That's Zaz Hollander, crackerjack reporter, 20-plus years at the Anchorage Daily News, right here with us. It was an honor to have her with us because she typically doesn't do these interviews. So awesome. Brian Butcher's next up, head of Alaska Housing Finance Corporation. Stay with us. Tom Anderson Show.